Good afternoon, and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator. We're here for update number 94, and we'll be here each Wednesday at noon for these updates. This forum is being brought to you live by PAC TV on Comcast Channel 15, Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants include, once again, Dr. Mark Wilson. He is a local epidemiologist. Karen Keane, she is the Director of Public Health for the town of Plymouth. We also welcome Dr. Christopher Campbell. He is Superintendent, Plymouth Public Schools. Michelle Bratti, she is Director of Elder Affairs for the town of Plymouth. And Matthew Muratore, Plymouth State Representative, joining Ken Tavares and me. And we're going to begin, as we do each week, with an opening welcome from Ken Tavares, Chair of the Select Board. Welcome, Ken.
Steve, and good afternoon to everyone. It's a pleasure to be here once again. I have just one request for those that are listening, and that is to please register to get your shot. It's so important at this stage of what we're going through that you register. If you need help, please call the town hall at 508-747-1620. And in a few minutes, Michelle Bratti from Cal will be speaking to us, and they are a phenomenal source of information and help for all of us. So take a few minutes. It's for yourself. It's for your loved ones. Register so that you can get inoculated. We are making progress. Thank you, Steve.
Thank you, Ken. And perhaps some employers might consider what I had decided in my office was on the day when anyone could register, we're going to allow any of our employees who have not previously registered be able to do so that morning. So thank you, Ken Tavares, for that opening request. At this time, we're going to begin our medical segment, and we welcome back Dr. Mark Wilson. Welcome, Mark.
Thanks very much, Steve. Actually, what I'd like to do today is follow up on Ken and your comments about vaccination and answer a few questions that I thought might be useful and interesting to the listeners. So the first one is, do I need to wear a mask and avoid close contact with others if I have already gotten both doses of the vaccine? The simple answer is it really depends. The CDC currently is recommending that, at least for now, fully vaccinated people can gather indoors without physical distancing or wearing a mask if you are with other people who are also fully vaccinated, or if the unvaccinated people who you are with are from one other household, unless, of course, they are at high risk for severe illness from COVID. So until more is known, those of us who are fully vaccinated should really continue to wear masks and socially distance in public settings, or when we're around other unvaccinated people from multiple households. As more and more people become fully vaccinated, as we just mentioned, these restrictions will be removed, but until conclusive research is announced, it's better to err on the side of caution. A related question is the following. We all know that anyone who is infected with the COVID virus could be asymptomatic and unknowingly infect others. But once someone has been vaccinated, is it still possible to be an asymptomatic carrier? So here again, the answer is yes, it's possible, but it's extremely unlikely. A recent study of more than 28,000 people who had received their second dose of the vaccine showed that only 7 had a positive test, virus test, at 2 weeks after completing their vaccination. So this means that only 0.05% of people who were fully vaccinated had an asymptomatic infection. And it may be that those few people also had very little virus and were not highly infectious to others. So this is really very reassuring, but it's still advisable for now to wear a mask after being vaccinated whenever you're around others who do not regularly interact with you. Again, better to be safe for now. Here's another question about symptoms after vaccination. I understand that most vaccinated people who are later exposed to the COVID virus will not get seriously ill. But could they still become COVID long haulers and have to deal with ongoing health problems well into the future? So studies are currently underway to address this, and there's not yet any definitive results available. Nevertheless, many infectious disease experts, myself included, believe that by getting vaccinated, you will have reduced your chances of experiencing long-term symptoms. We know that the vaccination prevents severe disease and it shortens the time of infection. In those of us who are vaccinated, multiplication of the virus and entry into body tissues or organs is dramatically reduced, which means fewer of our normal body functions are affected. In addition, long-haul COVID cases are really fairly rare. So vaccination reduces the overall number of infections and probably is going to further reduce the chances of having any long-haul symptoms. Yet another reason to get your vaccination as soon as possible. Finally, this question about vaccine safety. My mother is taking immunosuppressant treatments for a bone marrow transplant. Although she has been vaccinated, I'm not sure the vaccine is going to be effective. Should she just assume that she has not been vaccinated, or is she likely to be protected? So in general, if your immune system is depressed, your immune responses following infection or vaccination may not be quite as strong. But regardless, vaccination will provide some protection and is definitely better than not getting vaccinated. But additional precautions are probably a good idea, since people who are immunocompromised may be less protected against COVID than others with normal immune systems. So once you're vaccinated, just be extra careful in crowded indoor settings and with people who you're really not part of as your immediate family. So I'll stop there, and I'd be happy to answer any questions that viewers might have later on in the program. Thanks.
Thank you, Dr. Mark Wilson. And as a follow-up to issues involving even fully vaccinated people, I would report that on Friday I'm having a minor foot procedure, and as a precondition to that, I had once again another COVID test yesterday, even though I've been fully vaccinated for several months. And as we move to Karen Keane, Director of Public Health for the town of Plymouth. Karen, we're also seeing invitations for gatherings where the invitation is extended to people only who have been fully vaccinated. I've received a couple such invitations for outdoor gatherings, and I was present at a discussion on Monday where a business gathering was being planned with such a limit to the attendees. So, Karen, what do you have for us today as the Director of Public Health for the town of Plymouth?
Thanks, Steve. Following what Dr. Wilson had to say about vaccines, I have some information regarding the J&J vaccine that I think is important for our residents to know. As you may know or may not know, the J&J vaccine, in an abundance of caution, has been stopped. The administration of that vaccine has been stopped in the United States. 6.8 million J&J vaccines have been given in the United States. That's the one-dose vaccine. Of these 6.8 million doses, there have been 6 cases where a rare blood clot disorder has resulted from those vaccinations. Over 180,000 doses have been given in Massachusetts without any problem at all. So out of abundance of caution, again, the United States has stopped administering the J&J vaccine or the Johnson & Johnson vaccine or the Janssen vaccine, as it's also known, until they can do some further research as to what is happening with these particular 6 cases with this rare blood clot disorder. The 6 particular cases also had a pre-existing condition with a low blood platelet count, and they believe that may have been a contributing factor. Now, if you have received the J&J vaccine here in Massachusetts and you have concerns, you should contact your local healthcare provider. That also leads us to our next item I want to talk about, which is a little disappointing in reference to the J&J vaccine, and that is our homebound resident program to receive the vaccine. We here in Plymouth partnered with the state of Massachusetts to administer the vaccine to our homebound residents. The vaccine that was selected for that program is the J&J vaccine because it is a 1-dose vaccine, which is beneficial when you're dealing with the homebound population, so you do not have to schedule that second dose and go back through all of those deliveries again. That being said, that program is now on pause temporarily until again the United States can lift that stoppage for the J&J vaccine. So the program will still continue. It's just on pause right now. So those residents out there that do fall under that homebound program, we will be reaching out to you. It's just not going to happen as quickly as we had hoped. Also, something to think about as far as questions is concerned is people have asked this office many times, now that I am fully vaccinated, when am I considered fully vaccinated? And you are considered fully vaccinated after you have had your 2 doses of Moderna or Pfizer, or you had 1 dose of J&J, and it has been 14 days past those final doses. Then you are considered fully vaccinated. Here in Massachusetts, and especially in Plymouth, we still have a mask order, which means even though you are considered fully vaccinated, you still should be wearing your mask and social distancing. What one difference is, though, however, is once you are fully vaccinated, should you be exposed to a confirmed case of COVID-19, you do not have to quarantine. So that's a big difference. In the past, if you were exposed to someone who was COVID positive, you had to quarantine for up to 14 days, depending upon whether or not you were testing and whether or not you had symptoms. Once you are fully vaccinated, 14 days post final dose, you no longer have to quarantine if you have been exposed to someone who is COVID positive. Along with people we want people to wear masks and to continue social distancing. My final item today is that COVID ambassadors are back. We are very lucky to have these COVID ambassadors back here in Plymouth again for the spring, summer, and fall season. They'll be working downtown and on the waterfront 7 days a week. They are there for educational purposes, to remind people to wear their masks, why wearing masks are important, and to encourage social distancing, especially in those areas that tend to be a little crowded in the nice weather. So we welcome them back, and so people will be seeing them around town and around the waterfront. So that's what I have today, Steve. Thank you.
Thank you, Karen Keane. She is the Director of Public Health. She's available with our panel to answer your questions. Send them to PlymouthInfo@pactv.org. And now we're moving to our educational segment. We welcome back the Superintendent of Plymouth Public Schools, Dr. Christopher Campbell. Welcome, Chris.
Thank you, Steve. Good afternoon. Good afternoon, everyone. We're just so happy to welcome back all of our students this week. Our staff has worked extremely hard to prepare our classrooms for full return. So we welcome back our elementary students on March 29th and our secondary students this past Monday. It goes without saying that this has been a difficult year for our students as well as our families. And it's also been most demanding circumstances our educators have ever faced, in my opinion. There's been no easy answers this year as we've addressed the challenges of the pandemic, but I just want to take a moment to personally thank our educators for the tireless and extraordinary work that they've done on behalf of all of our children. And I want to thank our families for their patience and consideration that they've shown and that they continue to show as we work through this extraordinary public health challenge for the last 13 months now. It's hard to believe it's been 13 months. I've had the opportunity to engage with many students during my weekly visits to schools, and I have to say that the joy expressed by so many students at all levels, seniors included, has been amazing. It's been very gratifying to hear so many of our students eager to be back every day, spend more time with their teachers, and see some of their peers that they haven't seen since last spring. I think we would all agree that nothing can replace the experience that our students receive by attending school and being with their teachers. So as we approach April break though, so we get all of our kids back this weekend, we're going on vacation. We just want to remind families, our students and our staff about travel advisories, as well as other important health and safety matters. And we understand that the weather is improving. Today's a beautiful day, and everyone's anxious to get out from under the restrictions that we've been enduring for over a year. However, it's really important that we don't take a step backwards in providing a safe learning environment for our students when they return from vacation. So really, by exercising safety protocols in schools and with everyone's continued support at home, I know I say this every time that I'm on the show, we've been able to continue in-person hybrid learning since September, and now we're working really hard to get our students back in school and keep them in school. So we've really, done a remarkable job to prevent the spread in virus through all the safety protocols and the prevention strategies. And we're always concerned about community rise. So if we can just do our part and hang in there when we're not in school, we'll be better for it. Vaccines, I know vaccines have been discussed now by both Dr. Wilson and from Ms. Keane. We've made great progress as an educational system with vaccines for our staff. Very happy to hear that and to say that. So between the state's dedicated vaccination days, which officially ended on the 11th, I believe, along with the availability of additional vaccines through such organizations as Kingston Med Spa and the Marshfield Fairgrounds, opened up some opportunities for us. It seems that every member in our district, the faculty and staff that was seeking a vaccine has had the opportunity to do so, at least partially at this time, which is very encouraging. So we're really happy about that. And as Dr. Wilson mentioned, we're making progress with the administration of vaccines, but we have to continue to be vigilant with our primary prevention strategies. And that's exactly what we're doing. We're promoting and supporting in our schools. So as we approach April break, we just encourage everyone to exercise caution with social gatherings and their travel, and just again, be vigilant in protecting yourself and others by wearing your masks, washing hands, social distancing, and keep your children home if they're sick, and really limiting gatherings, everything that we've been talking about for many, many months now. None of us likes the restrictions imposed by the pandemic, but we do ask that everyone just continue to follow the guidelines for travel and plan to quarantine upon return if necessary. And just look at the Department of Public Health spells it all out for you in terms of advisories. So another strategy that we have utilized really since last February is COVID surveillance testing, and these are still available. So our district will once again be offering COVID test kits to anyone, staff or students interested. So any families can pick them up prior to April vacation. So the goal of the test kit is to provide our students a convenient, no-cost testing opportunity in order to provide the community an added measure of safety and reassurance. So this testing is completely optional, and it's at the discretion of the student's primary caregiver if they want to participate. However, if you're going to use this test, we ask that you pick it up before the break and you administer the test to your child or yourself as a staff member by Thursday of that break, and drop it off in a FedEx. Everything is in the package, and we'll get those results back before students and staff return. So the test results are confidential. It's a saliva-based test, so it's non-invasive, and the information only goes to the individual and to my office. So if you receive a positive result, you'll get an email, and then we just ask you to contact your school building. But it's just another way to keep our schools safe. These kits are available through the remainder of this week. So if you're interested in picking up a kit, they are available now through Friday at your child's school during school hours. So just please report to the main office for reception, and someone will help you with any questions you have about that. Speaking of April break, we're also going to be offering an April Enrichment Week, the week of April break. So students in grades 2 through 12 are invited to join us at April Vacation for fun workshops for anyone that's interested in those grades. These workshops are being offered free to Plymouth Public Schools students as part of a Department of Education grant initiative that we were fortunate enough to receive to provide vacation opportunities to students. So space is limited. Please go to our website to learn more about how you can register your child for any openings. I believe we have 11 opportunities that we're offering this vacation. They're 3-hour sessions, either morning or afternoon. And again, go to our website for more information. Our enrichment program was conducted in a socially distanced manner this past February break, which we will do again this April, and it was a huge success. So we look forward to that as well. And then lastly, while it's only April, graduation planning is upon us, and I'm happy to say that graduation will take place on the campuses of North and South High Schools on June 5th as scheduled. We've actually set a rain date of June 6th, so we can plan for an outdoor ceremony. So for those in the public, the Department of Labor Standards, in consultation with DPH, recently issued guidance on commencements and graduations, and these guidelines allow for graduations both indoors and outdoors, but only when the conditions outlined in the guidance can be met, including physical distancing, mask wearing, limited amount of guests, etc. So we'll be sharing additional information regarding the ceremony, the tickets, and other logistics in the near future. But we're really happy to announce that we will be doing an outdoor graduation, and we look forward to planning for that. So that's all I have this afternoon, Steve.
Thank you. Dr. Christopher Campbell, Superintendent, Plymouth Public Schools. He's here to answer your questions. Send them to plymouthinfo@pactv.org. And at this time, we're going to go to Michelle Bratty, Director of Elder Affairs. And Michelle, at our opening, we got a tease from Ken Tavares about what you have for us today.
Okay, well, thank you, Steve, and PAC-TV and Ken for having me as a panel guest. It's so good to see everyone. Well, Cal has been very busy these last few weeks. Vaccines are on everyone's mind. We've been on a quest to ensure that Plymouth seniors have access to a local vaccination. We've been lucky enough to have partnered with Skin Esteem Med Spa in Kingston over the last 6 weeks in a community effort to ensure that the most vulnerable and at-risk senior members of our community had the opportunity to receive a local vaccine appointment, as it was difficult for many to travel further distances to mass state sites. Skin Esteem Med Spa has vaccinated approximately 5,000 local Southeastern Mass community members, and I am so happy to report Cal was able to ensure that approximately 500 of those were mostly Plymouth senior community members. Cal, along with our town manager, worked effortlessly with owners Dawn and Matt Naylor towards the mission of ensuring at-risk seniors were vaccinated, and Skin Esteem should be commended for their historical contributions towards unprecedented health measures. Skin Esteem has now ended first dose vaccine clinics, and we were honored to be part of this process with them. That being said, Cal has and will continue to be here for our senior population. Call us 508-830-4230, and we will assist anybody that needs help in procuring a vaccine. We do not have vaccines at Cal. Most people know this by now, but we have a really crafty and really educated and really enthusiastic staff that is willing to assist people. We have phone numbers, we have websites. Sometimes we have little tricks that might be able to help. So give us a call if you need a vaccine. We'll help you find that. The Center for Active Living, in partnership with Duxbury Council on Aging, were the honored recipients of a field demonstration grant through the Mass Council on Aging. This grant was designed to decrease social isolation, reduce loneliness, and promote healthy connections through small group gatherings in a safe manner. Joint planned grant events include cooking demonstrations, in-person flower arranging, a barbecue mastery class, and a cornhole tournament. That will be in June. Plymouth versus Duxbury for town bragging rights. So I am actively recruiting secret senior Plymouth ringers for this competition. Plymouth must win. We must come out on top and beat Duxbury. We have a few spots left for our Cooking Together event out of this grant this Thursday, tomorrow, April 15th, and invite you to join. Cal will provide to you all the ingredients to create a delicious spinach and artichoke pizza while watching MCOA's Tara Hams cook live. In the spirit of promoting healthy connections, we invite you to share your dish with a family member or friend. If you'd like to participate, please call Cal to register today. Space is limited. Cal would like to extend a special thank you to Select Board Member Dick Quintal for taking the time to offer ingredient assistance on this project. Your help is appreciated. Cal was also awarded the Living Your Best Life Resiliency Training Course grant by MCOA. We are excited about this nationally recognized program and encourage you to register for this elite 10-week course event, which begins April 28th. For more information, contact Cal. Cal is excited to welcome our new Coordinator of Support Services, Mary Beth Ryan, to the team. MB, as she likes to be called, those are my initials too. It's fun around here, is taking over the important role held by Terry Greer, which is regarding Meals on Wheels. Terry is retiring from Cal on April 20th and has so earned this rite of passage. Terry has served our town for 22 years and has done so with class, kindness, and excellence. We will be holding a drive-through wave and well wishes parade in her honor on Friday, April 23rd from 12:30 to 1 p.m. at Cal. So please feel free to drive up and say your farewells. That's all for now. Thank you, Steve.
Thank you, Michelle Bratti, Director of Elder Affairs for the town of Plymouth. She'll be here with the rest of our panel to answer your questions. At this time, we're going to go to Matthew Muratore. He is a Plymouth State representative. He's here each week. Welcome, Matt.
Hey, Steve, how you doing? I can't really top what the cornhole tournament that Michelle is doing, but I'll try to do my best. Just give you some numbers today, Steve. The total confirmed COVID cases in Massachusetts is 622,662. We have 36,775 active cases as of yesterday. The death toll has unfortunately reached 17,000, or a little over 17,000 at this point. The 7-day average has still remained the same at, we're at 2.42%, so we're still running that mid 2.0 mark in the Commonwealth. I know Plymouth is over the 4% threshold. That's why they're still in the red at this point. Hospitalizations still remain around the same. We're at 714 folks in the hospital as of yesterday, with 165 in intensive care, and 100 of those have unfortunately been intubated. With regard to the vaccine, we have 1.8 million Mass residents fully vaccinated against the virus. 4.6 million doses have been administered, including 2.8 million first dose shots of Pfizer, Moderna, and 192,920 of the J&J vaccines. We're first in the state. The Commonwealth is first in the state with at least 5 million people to give a first dose to more than half the adults. 53% of adults have at least one dose of the vaccine at this point. We are sixth in the country for first and second dose administered per capita in the country. 70% of the 75 plus age group are fully vaccinated in the Commonwealth right now. And 50% of those 65 to 74 have been fully vaccinated at this point. With regard to the J&J pause, not going to have too much of an effect on us in Massachusetts. We actually built our programs around the Pfizer Moderna anyways. So the J&J was not a big part of that. And when you start looking at the supply, we were only expecting 11,600 J&J shots this week, and compared to Pfizer and Moderna, which is 380,000. So we're not going to be really impacted by that too much at this point. And we do expect more vaccines to be coming along the way. And the last thing I just wanted to share too is just the vaccine doses administered by practice type. So who's giving out these vaccine? And the top five, it's kind of interesting. Hospitals lead the way with 1.2 million vaccinations being given. CVS and Walgreens, which is part of the federal program, have given out 922,000 vaccines. The mass vaccination sites come in third at 755,000 vaccinations they've been giving out. The regional collaborations that we've been talking about, and more have been added. There are over 300 sites now giving vaccinations throughout the Commonwealth. The regional vaccinations come in fourth with 448,000 doses administered, and then community health centers at 304,000. So it just kind of gives you an idea of who's actually giving the vaccinations at this point. We do expect more regional collaborations to come online. As you know, Monday, Steve, is a date that everyone can go and get vaccinated at this point. So just go on the mass.gov COVID vaccination website to make your pre-registration to be vaccinated. And we expect it's going to take a few weeks, but with the amount of vaccinations we are getting from Moderna and Pfizer, we expect that hopefully by the middle part of June, anybody who wants a vaccination should be able to have at least one and most likely two at that point. So more to come on that next week, Steve.
Thank you. And that's Plymouth State Representative Matthew Muratore. At this time, we're going to go to our question and answers. And before we do that, we're also going to look at next week's lineup. Ken Tavares and I will be joined by Dr. Philip Triffletti, an attending primary care physician, Dr. Barry Potvin, the chair of the Plymouth Board of Health. Also, Pearl Sears, our town clerk, will be telling us about voting plans for the upcoming town election in the next few weeks. And Amy Naples will be heading up our business segment. She's the executive director for the Plymouth Area Chamber of Commerce. And our legislator next week will be State Senator Susan Moran. At this time, we're going to go to questions. And the first question that we have has to do with gatherings. And question's going to go to Karen Keane. And Karen, Margot, a viewer, writes and asks, what is the update with respect to numbers for gatherings such as weddings, both indoor or outdoor?
Great question. In fact, it was going to be one of my things that I mentioned when we were finishing up with the roundtable. Phase 4, step 1, the state of Massachusetts set their gathering limits private, 10 people indoors and 25 people outdoors. The town of Plymouth accepted those numbers as well for the town. The state set public limits at 100 for indoors and 150 for outdoors. And this is where the Board of Health for the town of Plymouth, based upon what they felt were the numbers, the fact that we were in the red, some other factors were involved, decided that they would make those a little stricter. So currently in Plymouth, our indoor limit for a public event is 60. And our outdoor limit for a public event is 100. The Board of Health meets the second and fourth Wednesday of every month. It's meeting today. It's on the agenda, each Board of Health meeting, that decision will be discussed and will be taking an additional vote. So today at 4:00 is the next Board of Health meeting, where those 5 members will be discussing whether or not they will change those limits to either meet or become closer to what the state has established. But currently, right now, it is 60 for indoors and 100 for outdoors.
Thank you.
Thanks, Steve.
And we're going to continue with questions. We're going to go back to Dr. Mark Wilson. Dr. Wilson, question from a viewer. For people who have gotten the Johnson & Johnson vaccine, what signs or symptoms should they look for that could be symptomatic for the blood clots? If you know.
In general, you would experience severe pain, not not mild pain. And I'm not familiar with the details of this, but it's important to remember that this is extremely, extremely unlikely. And so I would not worry about these symptoms. I would only in the most extreme cases of pain of some sort or another, or of other disabilities, I wouldn't really pay much attention to this. I think it's really important to remember that this pause is actually a very good sign because it's extremely rare. We have 6 cases out of millions who have been vaccinated. And so people should not be overly concerned about it.
Thank you. And that's Dr. Mark Wilson, and he is an epidemiologist in the town of Plymouth. Our next question is going to go to Dr. Christopher Campbell. Dr. Campbell, viewer asks, will class of 2021 graduates be able to invite guests to graduation?
"13 months and I almost didn't hit unmute. Excellent question. Yes, graduates will be allowed to have guests. What we're trying to iron out right now is just how many guests that will be. There are limitations on that, but it also has to do with the square footage of our outdoor space. So we are working that out, and we're waiting because there may be some adjustments to that guidance as well. So we don't want to release those details just yet, but they can, I would say to our viewer to hold on, and that information should be forthcoming relatively soon. But yes.
Thank you. Michelle Bratty, question regarding mental health. Many of the seniors have been the most at risk and most isolated throughout the past year. Can you speak to the mental health needs, and can we provide any information to seniors about where they can get help and support if they're feeling isolated or depressed?
Sure, Steve, and it's an excellent question, and it's a really valid point. We here at Cal have even seen an increase in what I'll call depression, isolation, loneliness that leads to feeling these feelings. I would say that first and foremost, if anybody, senior or otherwise, is feeling sad, depressed, unsure, just not in good space, you should automatically call, 911 if you're feeling in any type of way. But call us at Cal. We have resources that we can connect you with through therapy or some counseling or other resources that you may need. Our social outreach workers are here to help you regardless of what the need is. You always have an ear. Someone will listen and make sure that your needs are met. So if you are feeling any type of way, please reach out. That's the most important thing. The resource is making that call and looking for help and looking for someone to talk to. This has been a really tough year on the best of us, especially those that suffer some mental health issues. Don't hide. Isolation's not good. It's not good for you. Reach out. We are confidential. We will understand and we will help you. So 508-830-4230. Also, you can always reach out. Beth Israel Deaconess, BID, has an amazing social work department that would steer you in the right direction as to what resources are available in our community as well.
Thanks,
you,
Steve. Michelle Bratty. She's with the Center for Active Living, and she's the Director of Elder Affairs. Matthew Muratore, a question that we have. How is the pandemic impacting state discussions regarding work on the fiscal budget?
Well, first of all, Chris, I figured out how to do this button thing a while ago. I think we're approaching our 100th show now, so you get used to it after you're doing this a long time. Yeah, good question, Steve. We just had our House Ways and Means final budget meeting this morning, and the budget is now released to the public as of noontime today. So there is, I was just discussing with Ken before we went on the air, Chairman Tavares. The budget is looking pretty good. We've been able to increase services in so many different areas, particularly areas of around, mental health. We've also been able to increase local aid funding to 3.5%. Schools, a major increase into schools as well, and the Student Opportunity Act money. A lot of that money is going to be coming in this year as well. So it looks pretty good. The funding that we're receiving from the federal government, which is we're looking at about almost $5 billion, is not part of this budget. We're going to look at that money in June because a lot of this will be one-time spending. So we're going to get through the budget through the House. We're going to debate it the end of this month, end of April. We'll get it finalized, and then the Senate will work on their end of the budget the third week of May. And hopefully by end of June, we'll have a budget for the state, and then we'll start working on the extra money that the federal government gave us as well. So it looks pretty good.
Thank you. And we're going to go back to Karen Keane. One additional question, Karen. How are the numbers in Plymouth right now? Are we stabilizing or are we still spiking?
No, actually, our numbers are good. We're not seeing as many cases as we did when we had the second surge. We currently have 4,757 cases that we've had in Plymouth since the start of COVID, which was a year ago this past March. We currently have 170 people who we say active, which means they're either in isolation because they're a confirmed case of COVID, or they're quarantining because they were a close contact for a confirmed case of COVID. And we have had 150 deaths. And we have not had any recent deaths, and that's been confirmed today with the hospital as well, that even though they're still seeing some admissions having to do with COVID, that we, lucky here in Plymouth, we have not had any recent deaths attributed to the virus. Thanks, Steve.
Thank you, Karen Keane. And now we're going to go back to our panel for their closing statements. We're going to begin with Dr. Mark Wilson. Mark, what do you have for us today?
Well, in listening to the various presentations, I'm struck by the fact that the school system is, again, doing a great job with students returning to in-person classes. There are COVID test kits available, and a safe in-person graduation is planned. That's wonderful news. The special vaccination and social needs of our seniors in the area are being met, but nevertheless, new cases are still remaining high, and severe disease continues to be seen. So even though we're getting closer to normality, or something that will be similar to what we're familiar with from before, we're not there yet. And we still need to be cautious and to continue prevention practices and getting vaccinated as soon as you possibly can. The light is at the end of the tunnel, but we're approaching it very slowly now, and we have to be very careful. Thank you.
Thank you, Dr. Mark Wilson. He is Professor Emeritus at University of Michigan. And at this time, we're going to go to Karen Keane. And Karen, you are our Director of Public Health. What would be the takeaway today for Plymouth?
Well, the good news is we're approaching some really nice time with weather, and Plymouth comes alive with the waterfront and downtown, and we welcome so many visitors back to us, and that's absolutely positively wonderful. At the same time, I have to encourage folks that even though we have been dealing with COVID now for over a year, I used to say the foundation had 3 very large pillars. Well, now our foundation for safety has 4. And we have to remember that. We have to remember that we have to wear our masks. We have to socially distance. We have to continue to wash our hands and use good personal hygiene. And now we have to remember to be vaccinated. So we now have 4 very strong pillars that we need to have our strong foundation for our health here in the town of Plymouth, for both our residents and our visitors. So I would just encourage everyone to keep doing what you've been doing. I'm so thankful for our residents and our visitors here in Plymouth, and just encourage everyone to keep doing the right thing for those 4 big pillars. Thanks.
Thank you. And Dr. Christopher Campbell, Superintendent of Plymouth Public Schools, in your final closing remarks, can you also answer a question? To the best of your knowledge, do the state gathering numbers or limits apply to graduations?
So the limits for graduation were organized by the Department of Labor Standards in consultation with DPH. So it's different. The guidelines are different there. Yes. So thank you, Steve. Thanks for having me again. First, I just want to say I didn't realize how competitive Mrs. Bratti is, but I love that. I'm a big supporter of the Center for Active Living. So let's go beat Duxbury. I don't know if I have really any words of wisdom at this time, but I will leave your audience with this. You know, it's been a challenging year, but I've never been more grateful for the way that our school community continues to work together for the benefit of our students. You know, it's with the support of our families, our staff, our students, and our amazing local health experts that we've been able to continue to provide an in-person educational experience during a pandemic. So so grateful for that. You know, we know as a school department that we are under a microscope, and sometimes social media platforms provide their own commentary, and many times it can be untrue or misleading. So I just encourage the public to view our social media accounts for the most reliable information. We encourage anyone that may have any questions at any time to contact your school administration, our Director of Health Services, or my office directly. We're happy to talk to you. So in closing, I just want to thank our entire community for their continued support. It's so very much appreciated, and please take care. And I want to wish our students, our teachers, and our families a very happy, healthy, and enjoyable spring break. So thank you, Steve.
Thank you, Dr. Christopher Campbell, Superintendent of Plymouth Public Schools. We're now going back to Michelle Bratty, Director of Elder Affairs. Michelle, how do you want to close today?
Well, I'll confirm that I am very competitive, and it's based on pride that we have here in Plymouth. I have no doubt that we are very proud, and Plymouth will emerge victorious. There probably even will be some small competition between town managers, so Patriots style, if you will. So stay tuned. As Matt stated, we are leading the pack on vaccinated individuals in our state. A majority of Plymouth grandparents have been vaccinated. So on April 19th, please follow suit and ensure that you protect your elder loved ones. I do also just quickly want to remind everybody that scams are very real and do truly target our senior population. As many of you know, as a CAL director, I send a call to all of our patrons on a regular basis as a means to stay connected, impart important or relevant information, and simply to let you know that we're here and we care. Recently, scammers, those crafty ones, used my actual voice from one of those recorded calls as part of their introduction to solicit money for veterans. All of this was fake and sadly only an attempt to steal money from seniors. Please, please be cautious. Do not give personal information over the phone ever, especially credit card or identifying information such as social security number or birth date. Please also know that even if you think you heard my voice all the way through a recorded message, I would never ask seniors for money for any reason and know it's a scam. You can always call us if you're in doubt, but it's better to be safe than sorry. And finally, good news. CAL is working on a hybrid indoor-outdoor reopening plan for May, so stay tuned for details. Thank you, Steve.
Thank you, Michelle Bratty, Director of Elder Affairs for the town of Plymouth. We're now going to return back to Plymouth State Representative Matthew Muratore. Matt, you're not going to be with us next week. What do you have for us now?
No, I'm not. I'm finally going to miss this show. You're going to miss my face here. Sorry about that, Steve, but you have a great replacement in Senator Moran. She's very excited about coming on, so please treat her well, as you do me. I just wanted to thank Michelle really for that scam that she spotted right away and got a message out to people right away. That was quick thinking on your part, and it's amazing how these scams actually go. So that was a good message, and I do see that maybe Superintendent Campbell and Superintendent Antonucci may be doing some sort of betting on this tournament as well out of Duxbury. So There may be more betting involved, Michelle, there. I just want to go along with what everyone had to say today, about this community. It's just a tremendous community we live in. We've talked in the past, Steve, about, a lot of tough stuff have happened the last year and a month, year and 2 months now. But, a lot of positives have come out of these as well. And I think our community has gotten stronger. And I think the schools have led the way with that, and particularly our students and our teachers. They really have led the way and shown us how to do this. When you look at the unfortunate part of this is deaths, and Plymouth had 158 deaths to date. But when you look at the population, you look at the percentage of deaths, it's 0.002%. It's a very small margin, but it's because of the leadership that we have of people like Karen and Chairman Tavares and Superintendent Campbell and Michelle Bratti and just leading the way for us and just telling us what we need to do and how we need to do it. And we're so blessed with that. And it's because of that working together and that communication that we were able to get out through PAC TV that I swear has really made the difference in our community. It really has. And I'm thankful to everyone who's been involved and continues to lead the way. And, as Karen says, we still need to continue to be vigilant. As Mark Wilson said, we need to continue doing what we need to still do, continue, socially distance, washing your hands, wearing a mask, and by all means, go get the vaccination. It's not a big deal. Just go do it. As of Monday, you're able to get the vaccination. Just do it. It's going to help everyone else out in the whole community. Let's lead the way in this area, and let's get the highest percentage of vaccinations. And I know that's being tracked as well. So let's be the best. We want to win a tournament in between Duxbury and Plymouth. Let's win the tournament of vaccinations on the South Shore. We'll see you in a couple of weeks, Steve.
Thank you. That's Plymouth State Representative Matthew Muratore, who was a co-sponsor last year of a bill allowing town meeting to appear virtually. A viewer did send a question regarding whether or not the gatherings limit applies to town meetings. And at least as it relates to Plymouth, we will continue to update the community regarding whether or not that legislation has been extended for future town meetings. At this time, we're going to continue and go back to the chair of the Plymouth Select Board, Ken Tavares. Ken, what do you have for us?
Well, I agree with what Matt said. After 90 some odd meetings, you think we'd be, or I would be a little faster with the buttons, but nonetheless, I want to just talk about something that happened this weekend. On Sunday, I went to two events for the first time in over a year. One was to represent the town, and the other was a family gathering. And I felt protected because I've had my second shot, wore a mask, maintained the distance that was certainly necessary in order to attend both these functions. It can be done. I see that we're slowly waking up and getting back to what I hope will be the normalcy. But the caution that has been that we've been warned about today is extremely important. We can do it, and I agree with previous speakers. Plymouth, we can do it. I know we can beat Duxbury, and we'll until next week. I hope you all have a good week. Get those shots and enjoy Patriots Day that's coming up. Thank you, Steve.
Thank you, Kenneth Tavares. He is chair of the Select Board for the town of Plymouth. And as we complete number 94, it's true, we're going to circle back to number 100 next month. Meanwhile, we hope you'll join us each Wednesday at noon. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining today's presentation of our Plymouth COVID-19 update. Good day. Thank you.